Sleep apnea is an important aspect, I think, when it comes to any dentist and any dentistry, because it affects, when people have sleep apnea, they have tendency to clench and grind their teeth. And that damages the dental work that's done. And a lot of people complain, you know, I broke my crown, I broke this tooth, I broke this tooth, I broke this. We hear it all the time. And we're so apt to go in and just fix the teeth and not fix the problem, the clenching. And so then you get people who put people in night guards. Well, night guards actually increase sleep apnea. There have been studies that show you put them in a night guard, even though they didn't have sleep apnea, now they do have sleep apnea. So in treating sleep apnea the way we do in our office, of course, you have to understand that dentists, no matter how far we go in our CE and no matter what we do, the government does not allow us, the medical field does not allow us to actually diagnose, to come up with that diagnosis. We can see so many symptoms: scalloped tongues, you know, closed throats, closed nasal airways, dry mouths, and acid reflux. We see all these things in the dental room when we're doing your regular hygiene care. We send out for a sleep study. With that sleep study, it goes to a physician. That physician will give us the definitive diagnosis on what needs to go on and give us suggestions for treatment. Based on that information and based on what's going on in that sleep study, I don't just take the doctor's word for it. I look at that sleep study in depth. I go through that sleep study with you because I want to make sure you're understanding our course of treatment and what we need to do, because it's not just always a closed throat. And so that's how we treat our sleep apnea. And we go through that series of what treatments are required. What do we need to do? Is it an oral appliance? Does it open up your nasal airways? Do I need to refer you to an ENT? What do we need to do to help you sleep better? And then we follow up at the very end when we're pretty much done to it. We've got you sleeping good. Follow up with sleep study. Send it off to the physician again and say, listen, physician, here's where we started. Here's where we ended. What do you think? And it's great to hear them say it's working. And it's great to see those final results and then go over you with those final results so that you can see that it's working. And of course, the funny thing is when it comes down to it, you've got all the scientific study, you've got the appliances, you've got what we do, the treatments that we do. It really comes down to, how do you feel? Are you sleeping better? Are you waking up at night? Are you feeling refreshed in the morning? And that's most important to us. That's the point we want to get you to.